So in this slide, it's just a little bit of housekeeping, folks, and it's really just that this information presentation piece will be recorded. And then afterwards, we'll have a chance for questions and answers and discussion. That bit is not recorded. And really, we just ask that everybody respects that everybody's bringing their own experiences to today. We're asking you that when somebody's speaking, if you can listen with respect and don't interrupt. Also, don't share somebody else's story afterwards. That's their story to share, just as your story is yours to share. And we also ask that you don't fix or advise people or seek to rescue them this morning. Afterwards on the website, the recording will be uploaded at a certain point in the future. That way you can always come back to this presentation if there's anything you want to look at again. Once this piece is finished, the recording is stopped, and then we would ask you to turn your video cameras on with your audio off. And then it's really okay for you to ask questions or to share or not share. There's no pressure. Next month's Grief Talk session, the topic is navigating the journey of loss, and that's on the second Tuesday in November, and it's being presented by Dr. Helen Greeley. So it'll be a slightly longer presentation, and we'll really look forward to seeing you all there again. You simply go along to the website and register just like you did for this month. So I'm going to hand over now to my colleague Norma Jean. So Norma Jean, if you want to take over.
Yeah, sure. Thanks, Mary Kate. Thanks everybody. Lovely to be with you all this morning. I'm Norma Jean, one of the psychologists here in Cancer Care West. So like Mary Kate said, we'll try to keep this talk relatively brief, much more so that it might be, excuse me, a prompt reflection, prompt maybe some topics that you want to talk and share through or maybe ask questions about in today's session. So just the outline of what we're going to cover really in these next few minutes. It's just really maybe looking around how individual the process of grief is, but then looking at the specific factors that might influence that process. Looking through a model of grief and how grief can tend to go, what theories tell us about it, and just that grieving process. And then just maybe considering some things that might help with that. So grief in itself, I mean, suppose the title of the talk is really as to do different people grieve differently? And the answer, I suppose, is yes, that they do. And the reality is because grief is such an individual process. Because every individual comes to grief, comes to loss with their whole story with them, how they are in the world, all of their strengths, all of their vulnerabilities, their relationship with the person that they have lost. And so by its very nature, that's going to be different then for different people. For somebody, it might be a parent, it might be a sibling, it might be a child, it might be a partner. The role of that person in our lives, our relationship with that person, all of those things are going to influence how we might grieve in that. And I suppose it's kind of trying to acknowledge that there's no right or wrong way to grieve. It is very individual, it is very personal, and giving yourself permission and kindness to take that course with it that you're going to need to take for yourself. So I suppose sometimes like that we can get into comparing ourselves to other people or wondering where we are in the process relative to other people, but it's trying to allow yourself permission to take your own course with this, and that it is very individual, because part of grieving is trying to learn to be in the world without somebody that we love. And that might be the very first time that we're in the world without that person. It might be a parent or an older sibling that we have lost, or it might have been a lengthy relationship, maybe for all of our adult lives, and it could be the first time as an adult to be in the world without this person. So very much trying to give yourself permission to take that course, because it is very individual. I suppose what we do know from the research is that there are particular factors that can influence the grieving process and the course that it might take. So even for yourselves, I know everybody on the session today will have their own individual story, and different factors might have influenced them and how they're coping and managing. So things that can influence the grief and the grieving process and how we grieve can be the type and the mode of the loss. So whether it was expected or whether it was very sudden. And sometimes when it's very sudden, we feel that we hadn't really time to really process or get our head around what was happening. But similarly, if it can be very lengthy, perhaps somebody had a very long illness, where perhaps maybe they lived longer than maybe the initial prognosis had expected. They could have had a lot of different critical points in that illness, maybe points where they thought that, maybe things were looking very critical for them. And then they maybe rallied again. And so sometimes even in those circumstances, it can bring its challenges because maybe the person has always kind of rallied and come back again, but maybe this time that they have died. So all of those and the experience with that are going to influence how we're making sense of that. Then we have the relationship with the person that we've lost, like the nature of our attachment with them. If it's somebody that we've had a very secure attachment with, they could be a very important figure in our lives, very present in our lives, in our day to day. And so grieving the person we've lost in that context can feel enormous because it can have been such a part of our lives, even when the attachment has been very secure and very solid. But sometimes if there's ambivalence in that attachment, maybe where there's good and bad, and we're kind of confused or conflicted, that can bring its challenges in trying to grieve and trying to make sense of the loss. And similarly, if maybe we've had a very difficult relationship with somebody, things might feel unresolved or maybe they weren't addressed, and perhaps that can bring its challenges. Then you're also considering the factors associated with the person, with the individual who is bereaved, because we're all individual in the sense that what we have experienced in life to date are going to shape how we might approach a situation. So in this context, you're thinking of what are the individual's coping styles? How do they normally go about coping with something? Because that's going to play into how they might cope in loss. Like if, for example, somebody always kept things to themselves and they never wanted to share or talk about things with others, it's not like we're expecting a person to then have a complete personality change and cope with the grief differently. We're going to use what we know, and that can bring helpful kind of factors to us, or could bring challenges. So here you're thinking of like your own previous history of loss, whether there have been multiple losses, whether there are other co-occurring losses that have happened, and how we have processed or resolved those. You're thinking around maybe a person's general well-being, mental health, whether they had been struggling with other things going on in life at the time, whether there are kind of co-occurring events or other transitions or changes that are happening in life alongside the point where somebody has died. And those can impact as well. I suppose you're looking at what are the kind of co-occurring stresses that are going on for an individual. You're also thinking of, I suppose, general health of the person who has been bereaved and where they're at with that. And I suppose that can be impacted as well, depending on the loss and how they're grieving. And then you're also considering the experience around the loss, like the circumstances around that. Maybe has it led to secondary losses in losing this person in their lives? Did they occupy particular roles for us? Were they a person of comfort, of security, of support? Did they do particular things in the dynamic in the relationship? Now is the person trying to learn how to do those now themselves? So many new aspects of life that they might be trying to take on board that perhaps the other person filled. And it's not only the missing of them, but also the newness of trying to figure out, well, how do I go about doing these things myself? And how do I learn to do that, as well as grieving and missing and yearning for that person that I've lost also. So there's a lot of research around it, and we won't go in too heavy to it, but I suppose just to be considering those factors, there's a lot of things that will impact on that and how it might be shaped. Then in relation to more cancer-specific research, I suppose in this study, excuse me, they were looking at the factors that were present during the palliative phase of a person's illness, and then how family members and caregivers grieved afterwards. And I suppose the research shows that things that can influence that process and how we move through grief might be the level of social support we have, the psychological burden that somebody has experienced. I mean, we know from research that, generally family members really do want to care for a person, a patient who was very ill or maybe who's in that palliative phase, but it can be quite demanding as well also to do that. Not to the point that we wouldn't want to do it, but just the toll that it takes in trying to keep that up, as well as maybe other aspects of life. And research would show that trying to do that in that kind of caregiving role past 6 months, it's kind of that cutoff point where then we really can start to be more vulnerable to burnout and to just becoming depleted from it. Even though like that, we still wish to persist, it still is something that we value and want to do, but it's just acknowledging maybe the toll that that might have taken before we actually find ourselves maybe in the grieving process as well. It depends too on, was there much preparation for the loss? Was there much discussion in relation to the death? And when we're thinking of that, that's also going to be influenced by the patient, the person themselves that you have lost, how they coped with the fact that maybe their diagnosis was terminal or they're moving towards the end of life. Some people might have been in denial and needed to be in denial for their own ability to cope with what was happening, or some people might have accepted it and come to a different point in it. From what we see, like in movies and in the media and things like that, they often do paint a picture that most patients do move to a point of acceptance before they die. But generally speaking, that's not necessarily the case, and that's not the case for everybody. So sometimes for a person, it actually is very difficult for them to come to acceptance of that, to actually try to process what's going on. And they need to, for their own coping, to have an element where they need to deny it. And that's just as good as it can be. But sometimes that can mean that maybe things you would have wanted to discuss just weren't possible because the patient was coping as best they could, your loved one was coping as best they could, and then you're trying to cope with what that has meant. Then maybe for you, if you would have liked to talk about particular things. You're thinking around the kind of tensions that might have arisen, any kind of communication difficulties, whether or not people were present at the time of death, if that is something that is what they wished or was important to them. So those kind of factors can influence as well how somebody might move through the process. And then the end of life context itself, whether you feel it was supported, whether you feel that your loved one was well cared for, whether you feel that you got the time that you needed, all of those factors might influence as well how we move through the grief process, or whether or not we feel that things cause us to be stuck or feel unresolved in some way. And I suppose while we're talking about the different and kind of individual ways we might cope, then while you as an individual might be trying to cope with the loss of your loved one, we're part then of wider circles, maybe of a partnership or a family or the wider community. And because everybody is very individual, then you'll see that different people will cope differently then. And even maybe within a family, perhaps if it is a case that it is a sibling that you are grieving, the different members of that family will be on their own course and how they're trying to cope with it. It can be very hard because everybody is trying to cope at the same time with their grief and with the distress of it. As in, grieving is stressful, it's demanding, it's exhausting. And I suppose the fact that everybody is trying to go through that process at the same time, sometimes it can lead to different clashes, to different kind of conflicts, maybe opinions that, am I grieving too much? Is she grieving too little? You know, making those kind of comparisons, but really that's very, very unhelpful. It's trying to acknowledge that everybody will be coming to this process and yourself and family members will be on their own course with it. And that it's not that everybody is going to line up and be at the exact same point at the same time. So there might be times where one person is in a different position, and trying to accept that. Like, for example, if it is like, parents who have lost a child, like one parent might be more emotionally focused, might be looking to talk about it, might be looking to talk and get support and share their emotional experience about it. And another parent might feel that they don't want to do that, and that's not their style, where they want to get into the more problem solving, more kind of active elements of it, and that helps them to cope. That can be challenging because then we might look at the other and think, oh, you know, do you care as much or not as much as me? But maybe that's how it needs to be for the individual. So it's trying to have that communication as best you can and an understanding for yourself, and then for the people around you, that you're going to have to be on your own course with this. And there's no one size fits all for everybody in it. Let's move on. So then when we are talking about grief, then while we're talking about the things that can make it very individual and specific things that might influence you, generally speaking, when we're talking about grief, we're looking at this type of a model. So it's a dual process model. In the past, there used to be thoughts that, you know, grief moved through more linear stages, but a lot of the more recent research shows that that's not the case. It's very much, people describe it like having one foot in two different worlds, kind of, or each foot in two different worlds at the same time. So with this model, this dual process model, when it's talking about grief, we have two elements. First, you have this loss-oriented element on this side, and then the restoration element. So the loss-oriented aspect of this is the work of grieving. It's the remembering, it's the feelings of it. It can be very painful. It can feel very intrusive sometimes, as though we're just pulled into it and we feel it in our guts, like you feel it. And then there are other times where the restoration, we're in the more restoration sort of side of things. Now that's getting up, doing the things you need to do maybe learning new skills, attending the session this morning, having a good conversation with somebody. It's the distractions from the grief, like maybe something that you enjoy, things that are important to you. It's the getting up and putting out the bins and going to work, or going to, different activities or things that you're involved in. It's the living of life and tending to all of those new elements and to the distractions of it, alongside also trying to grieve. And I suppose we need both, because if you're entirely over here on the loss-oriented side of grieving all of the time, we wouldn't actually be able to function if we were there 24/7. It's too difficult. We'd be just so consumed. We actually wouldn't be able to get up and get out. And by the same token, if we're over here in the restoration element all of the time, just doing new things, just getting on with life and never considering the loss element, we're probably not really processing or integrating it. So how it goes for most people is it's over and back and over and back and over and back. And that's how the process continues. Over time, the intensity of being pulled into the loss side can change, or the frequency of that can change. But it is an ongoing process with it that over time starts to change. Initially, it can be very hard because it feels so intrusive when you're pulled into that loss-oriented side, and especially if you're somewhere where you don't really want to maybe share what's going on or feel the feelings that are associated with it. Perhaps you're somewhere you're not comfortable to do that. It can be very hard. But over time, that is how it changes. But it's realizing that both are ongoing and that we need both. Grieving is very hard work, and it's tiring, and it's painful, it's exhausting, and we need the break from it. Sometimes it's hard because people can then feel guilty that maybe they did do something that they enjoyed, that they did forget themselves for a minute and did laugh, and then feel bad thinking, how can I do that when I'm grieving? And yet it's so necessary that they do, because otherwise we actually wouldn't be able to keep back and doing the work of grieving. So we need the breaks from it as much as we need to do the work of grieving. And then if we're looking around the grieving process, I suppose, just as an analogy, initially, I suppose in that first year, it is very much the case where grief can feel that it's just taking up all the space. So if we're looking at that very first jar, it's like a jam jar with like a tennis ball squashed into it, and it does take up all the room. It's hard to really catch your breath or to consider other things because it just takes up so much space. And again, probably older ideas might have been that then maybe the next year it's more like a, golf ball, and the following year it's more like a ping pong ball, that it gets smaller. But that's really not the course that it takes, and nor is it what most people want either, because when we lose someone that we love and really care about, we're not looking for it to dissipate. We don't want to forget them. So instead, it's much more so that we actually get bigger to hold the grief. We get bigger in the sense that we might maybe go on a family trip for the first time without this person. Maybe we take up a new hobby and do something new for ourselves. Maybe we get chances to talk and share about our grief. And all of those things is where we grow space within ourselves to hold and to carry the grief with us. And as we grow bigger and have more space to hold that, that's how it starts to feel more manageable, rather than us expecting it to kind of shrink and get smaller and smaller and melt away like a snowball, because it's not really how it goes. What can make that process more difficult, though, is when we try to keep everything the same, when things aren't the same, when we've lost that person anymore. There might be elements of life that are the same, but when we try to very rigidly keep everything the same, now I mean for a prolonged period of time, after we've lost somebody, that can make it very hard, because our world isn't the same anymore, and it's trying to process and trying to adapt to that, even though it can be very painful to do that. So then, just very quickly, maybe, because I want to make sure you have time to talk and ask any questions that you want, but when you're thinking of what might help, then sometimes it's trying to keep it like very simple, like really trying to eat well, trying to exercise, trying to get your sleep regular when you can. Because like that, grieving is very stressful, and it's very psychologically demanding and physically demanding. So trying to take care of those basic needs as much as you can be really helpful. Trying to avoid turning towards things like maybe drinking a lot or things like that to try to escape it. And even though the draw might be there, in the long run, it can make the process more difficult. So trying to take care of the basics when you can, and trying to keep some kind of aspect of regular patterns where that is possible can be supportive. Really trying not to judge yourself, not to compare yourself to other people, just permitting yourself to experience your own process and to move through it in your own time. much like what we were talking about earlier, there are so many factors that will make this individual to you, and it is important that you allow yourself, I suppose, the space to move through this in the way you need to. Listening to yourself, thinking, how am I doing? What do I need? And then maybe trying to make choices from there. Like if you are overwhelmed, thinking, well, you know, do I need to go for a walk? Do I need to talk to somebody? Do I need to journal? You know, what is it that I need? So trying to ask yourself those questions, like, how am I doing? What's going on? What do I need? What would be helpful? And just trying to take care of that as best you can. Allowing yourselves the breaks, like we were talking about earlier, when you can and when you feel able for, so that you are almost trying to nearly fill yourself back up to then be able to continue to do the work that you're trying to do in grieving as well. Considering social supports, it might be like that, having even just one or two key people where you feel you can just be yourself, where you feel you can just share as you are, not have to put on any mask, just be as you are and have that outlet and support for yourself. And trying to let others help if you're able to do that, or to let them know how they might be able to help you. Some people don't really know what to say or how to help you, but if you can let them know what you might need or what they might do, even if it is just something very practical that might just take some burden off yourself, trying to let them to do that, and talking between people that you feel comfortable to around your memories, around your experience. Trying not to make any major life decisions or changes for at least a year or a year and a half when you're really trying to process like a major loss or a major grief in your life. And then I suppose just considering like that around coming up to important events or anniversaries, maybe planning in advance how you might want to spend them, considering any new traditions that you might want to make if that feels right for you, but maybe just keeping in mind how in advance of events, how you might want to go through them. So just lastly, before I finish, we're very much talking about when grief progresses normally and typically. And even though the process is very difficult, it is one that most people in time do find their own emotional equilibrium again and can move forward. But it's just a kind of flag if you feel that you aren't coping, or like any previous kind of vulnerabilities or mental health problems or traumas, you know, that you feel are linked with it. Try not to be on your own if you feel that your grief is not kind of moving along, if things are very stagnant, not to be on your own, and either to link with your GP, mental health services, or even ourselves if you feel that that's the right route for you, for just some individual support around trying to grieve and move through that process. So that was the end of the presentation part. So I'm going to stop sharing. Mary Kate, if you want to stop the recording.
I'll just stop the recording now.